A very good evening to one and all. I welcome you all to this news analysis initiative. These are the articles that are important from today's newspaper. Without any further delay, we will move on to the first one. This is the first article. Citizenship under CAA only if claims verified, Supreme Court. The Supreme Court has made one thing very clear. CAA does not give automatic citizenship even for Hindus, Sikhs, Buddhists, Jains, Parsis, and Christians from Pakistan, Afghanistan, and Bangladesh. Every claim must be verified. The court said rights under CAA come only after the government checks and confirms the authenticity of the persecution claim. This was said because many refugees panicked due to the SIR of electoral rolls. The court reassured that CAA applicants must first qualify for citizenship. Only then can they be added to the voters list. CAA modifies the Citizenship Act 1955, creates a special pathway for certain religious minorities. Supreme Court observation reinforces due process, verification, and administrative scrutiny before granting citizenship. The next article for the day: Trump mulls tariffs on Indian rice. The US President Donald Trump has hinted that he may impose tariffs on Indian rice, claiming India is dumping cheap rice in the US. This comes just days before a US trade team arrives in New Delhi to negotiate tariffs. India is the world's largest rice producer, producing around 150 million tons annually. Most of this is consumed domestically, but India exports roughly 23 million tons to 172 countries, making it the biggest rice exporter in the world. The US, on the other hand, imports around 1.3 million tons of rice, mostly aromatic varieties from Asia. A full 26% of these imports come from India. That means the US has a notable dependence on Indian rice. However, the US accounts for only 3% of India's total rice exports, worth about $400 million. India is not dependent on the US market, but the US is dependent on India for rice supply. So, tariffs may increase American consumer prices. The US already has 50% tariffs on India. This new move may escalate trade tensions. And the president has also announced this during a meeting unveiling a $12 billion package for US farmers, signaling pressure from domestic farm lobbies. This article is regarding the impeachment of High Court judges. We will just look into the procedure for that. If a High Court judge has to be removed, it's not an executive decision. It follows a very strict constitutional process to protect judicial independence. A removal motion must first be introduced in Parliament in either house, and it must be backed by a special majority in both the houses. The judge can be removed only on proven misbehavior or incapacity, and the charges must be examined by an independent inquiry committee. Once both houses pass the motion with special majority, the president issues the removal order. This tough process ensures judges are not removed for political reasons. This is the next article. The CAG report flags a serious learning continuity crisis in Odisha. Nearly 30% of students fail to move from secondary to higher secondary, pulling the gross enrollment ratio down even as the national average has improved. The state never analyzed the reasons, but the audit points to higher dropouts, poorer infrastructure, and data discrepancies. The next article is facial recognition for food aid. So basically, a group of Anganwadi unions has gone to the Bombay High Court saying that the mandatory facial recognition plus OTP system under Portion 2.0 is actually disrupting ration delivery rather than improving it. Workers say the app often fails, mothers don't have smartphones, OTPs don't arrive, and ration distribution gets delayed, causing real hardship on the ground. They are asking the court to make the digital process optional, not compulsory. This neatly fits into the broader theme that tech mandates without ground readiness can exclude beneficiaries, something we have already seen with Aadhaar authentication issues in PDS and MNREGA. The next article is regarding Aditya L1. India's Aditya L1, along with six NASA satellites, found that the May 2024 solar storm intensified because two CMEs, that is, coronal mass ejections, collided in space, squeezing each other so hard that their magnetic field lines snapped and reconnected, a rare process called magnetic reconnection. Okay, now what is the CME? It is a huge bubble of super hot gas and magnetic energy that the sun blasts out into space. When this bubble hits Earth, it can disturb our magnetic field and cause auroras, satellite glitches, radio outages, and even power grid issues. And this is the first time such a massive magnetic breakup inside a mass ejection has been observed. This will improve our ability to forecast dangerous space weather events. The next article is Care as Disability Justice. See, mental health distress in India is shaped not only by biological factors but also by social deprivation, trauma, caste, gender, and poverty. The article argues that India must move from a deficit based medical model to a framework of disability justice centered on dignity, relational care, and contextual understanding. Okay, now first we will see into why current mental health approaches fall short. First is the deficit lens dominates. Focus on fixing individuals and integrating them into rigid social norms of productivity. Second is a high treatment gap. Services do not reach those who need them most. Narratives of lived suffering ignored. Abuse, homelessness, stigma, and deprivation often go undocumented and unaddressed. Fourth is over reliance on medication and protocols without addressing family conflict, social isolation, caste discrimination, or intergenerational trauma. The fifth is structural biases in care systems. Marginalized groups face both poor access and discriminatory treatment. To provide care, we must understand this mental distress. The article emphasizes that distress arises from several overlapping factors like biological, neurotransmitter issues, inflammation. The second is the psychological, learned patterns, cognitive distortions, social isolation, economic precarity, and stigma, cultural loss of meaning systems, political oppressive structures, weak safety nets, historical colonial legacies, and intergenerational trauma. So, mental health needs intersectional solutions rather than unidimensional treatment. So, how should we reframe this mental health care? The first is the a pursuit of dignity, respecting autonomy, emotional needs, personal goals, and lived realities instead of seeing distress as maladaptive behavior. The second is centering equity and inclusion, recognizing that caste, class, gender, and queer identities shape suffering and access to care. Third, relational and not transactional care. Healing requires long term engagement, trust building, and presence, not just medicines or brief consultations. Number four, recognition of material deprivation. Housing, poverty, abandonment, and social disconnection often create or worsen mental illness. Number 5, non-linear recovery models. Understanding that setbacks are part of care and not failure in the treatment. Number 6, holistic support. Combining medication, livelihood, community connection, spiritual coping, and caregiver support. So, how do we strengthen our system? The first is the education reform. We have to train our mental health professionals to hold discomfort, ambiguity, and complex stories, to work with families and communities, to engage with socio ecological context. Number two, recognizing non specialists, that is, community workers, peer supporters, people with lived experience as equal stakeholders with compensation and training. Number 3, research transformation. Shift from only large scale statistics to lived experience narratives, implementation science, and real world outcomes like continuity of care and trust building. Now, why all this matters for India? India has a massive treatment gap and extreme social hierarchies, and homelessness, caste violence, poverty, gender based exclusion, and stigma worsens mental illness. Without addressing root causes like deprivation and discrimination, biomedical care alone cannot deliver dignity or recovery. The next article for the day is Starting an Agenda on the Right to Health. India's public health systems continues to face chronic underfunding, inequity and rising commercialization. The National Convention on Health Rights seeks to redefine healthcare as a basic human right, drawing lessons from the pandemic and emphasizing a people-centered approach rather than a profit-driven one. The National Convention on Health Rights is a unique platform for around 400 health professionals, community leaders, and health activists to address India's major health challenges. Now, what are the challenges to the right to health in India? The first is the privatization and weakening of public systems. Rapid expansion of PPPs and outsourcing of medical colleges risk dismantling public provisioning, making healthcare unaffordable. Poor implementation of the Clinical Establishments Act results in overcharging, unnecessary procedures, and violation of patient rights. Number 2. Low public spending. Only 2% of the union budget for health, per capita public spending 25 US dollars, among the lowest globally. High out of pocket expenditure persists despite insurance schemes. Number 3. Inadequate regulation of medicines. Over 80% drugs are sold outside the price control. Irrational combinations and high markups hurt poor households. Need for rate standardization, transparent pricing, and stronger regulation. Number 4. Precarious conditions of health workers. COVID 19 exposed poor wages, contractual insecurity, and lack of social security for frontline staff. Number 5. Social discrimination. Persons from vulnerable sections and persons with disabilities continue to face barriers in access, and structural inequities weaken this universal health coverage. So, what is the agenda for this rights based health system? Number 1 is strengthen the public health systems, expand public sector financing, reduce dependence on insurance driven models, promote decentralized planning and community participation. Number 2, we have to bring in regulatory reforms like enforcing Clinical Establishments Act, adopt Charter of Patient Rights, ensure transparent grievance redress. Number 3, ensure equitable access to medicines, expand the price control, and enhance public sector drug manufacturing and remove GST on essential medicines. Number 4, justice for health workers. We have to provide them fair wages, regularization, and safe working conditions. Number 5, address social determinants, that is, integrate policies on food security, environmental health, gender equity, and climate resilience. So, India's right to health agenda must shift from this fragmented, commercialized models to universal, equitable, and publicly funded systems. Okay, the next article for the day is a deep cleaning of India's electoral rolls. And the other one is the SIR of poll rolls is not new. Several have taken place since 1952. Law Minister, I'm combining both the articles and giving you a holistic picture. And this was written by the advocate who represent the Election Commission of India in proceedings. If you want a clean election, you first need a clean voter list. Dr. Ambedkar had said this in 1950 itself. But over the years, our rolls have become messy. Duplicates, dead voters, migrants, wrong entries. So, the Election Commission's special intensive revision is basically a deep cleaning exercise to fix this foundation. So, why it is needed? India today is extremely mobile. People constantly move for work, studies, and marriage. Because of this, our electoral rolls are full of outdated and inaccurate entries. Since the last full intensive revision happened in 2002 2003, doing another round now was actually overdue. Now, why it is facing a lot of criticism? Petitions were filed in the Supreme Court saying SIR is unconstitutional, it will lead to mass deletion of genuine voters, ECI is overstepping by rechecking citizenship. But the truth is, the Constitution itself gives ECI the power to supervise electoral rolls under Article 324. And citizenship is a mandatory eligibility condition, Article 326. So, the ECI has the authority and the responsibility to verify entries. So, the real challenge is verifying the citizenship. India does not have a national population register linked to citizenship. NRC is not implemented, or automatic information sharing between agencies like in Germany or Canada. So, the ECI has to manually verify who is an Indian citizen and who is eligible to vote. This is not about disenfranchisement but about cleaning up inflated or incorrect list. So what ECI did differently this time? That is, what are the reforms under this SIR 2025? The first is the door-to-door verification. Every entry was physically checked. The second, more liberal documentary proof. Earlier, only 4 documents were accepted. Now, 11 types of documents are valid. Number 3 is Aadhaar is accepted based on the suggestion from the Supreme Court. This reduced paperwork and the confusion. Number 4 is digital transformation. All documents are digitized for the first time. Online claim, objection filing, and digital enumeration forms. Number 5 is political party involvement. 1.6 lakh booth level agents are trained. Full transparency with parties in sharing draft rolls is also involved here. The next is the assistance for citizens. Supreme Court deputed legal aid volunteers helped people file corrections. In Bihar's SIR, 7.5 crore entries were verified. 65 lakh names removed because of duplicates, dead, shifted, or ineligible. But only 36,500 people applied for re-inclusion, which is just 0.56% of deletions. Not a single appeal was filed against deletions. This indicates the deletions were mostly accurate and not arbitrary. Now, why this matters for Indian democracy on the whole? A clean roll will prevent bogus voting, it will protect genuine voters, it will improve the trust in the elections, and it ensures fair representation. So, this special intensive revision is not about throwing people out, it is about building confidence in the democratic process. Okay, in this there are 2 words. The first is the quantum echoes. Quantum echoes are nothing but the technological leap that we achieve in quantum computing, that is known as quantum echoes. See, this Willow experiment is nothing but a Google's Willow quantum chip. It is a major advancement in quantum computing, and it is able to solve the complex problem in minutes that would take the classical supercomputers 10 septillion years. Okay, and paving the way for practical quantum applications in AI, drug discovery, and energy. When the quantum computer becomes so powerful that it can break the public key encryption, that is known as the Q-Day. So there are 3 terms. One is the quantum echoes, the other one is the Willow experiment, and the other is the Q-Day. Okay, 3 things. The next article is value of water. This is a study basically asked a simple but powerful questions. You can use this in essay, also in your general studies mains answers. Okay. How much do people really value clean drinking water when the usual hassles are removed? Okay. Researchers worked in rural Odisha where many homes still don't have piped water. Instead of asking people indirectly, they delivered clean water straight to households and observed 3 things. How much water people bought at different prices. That shows the willingness to pay. Second, how much they consumed when it was free. The real demand. Whether they preferred water or the same amount of cash. Willingness to accept. Now, the key findings of the reports are People valued clean water much more than earlier studies suggested. Many families chose water over cash, showing how essential clean water is. When clean water was easily available at home, people stopped using unsafe sources and spent less time fetching water. Earlier studies underestimated value because they measured adoption of chlorine, filters, or walking time, all of which involve extra burden. When these burdens were removed, real valuation actually shot up. Households reported feeling healthier even if medically it is not measured. So, what this means for the policy? Now, people are willing to pay for clean water, but only if access is convenient. Government can support local home delivery models in areas without pipelines. Pricing should match people's willingness to pay with subsidies for poor households. Water policy should focus on making clean water easy, reliable, and dignified, not just pushing technologies like filters or chlorine. The Indian Nepal joint military exercise Surya Kiran has concluded in Uttarakhand. This annual exercise focuses on improving counter terrorism operations. And regarding this article, we have clubbed it with the editorial. The next article is ensure free content access for LLMs. Okay. LLMs are basically large language models like how we use in ChatGPT. That is what it is. Okay. A government working paper has suggested that AI models like ChatGPT should be allowed to freely access all publicly available online content for training, and publishers should not be allowed to opt out of this. Now, what the government proposes? The first is the free access to online content for AI. Anything publicly available can be used by AI for training. Second, a copyright society model. A new non-profit organization should be set up. Like music royalty societies, AI companies will pay a royalty fee. Money will be distributed to content creators, members as well as the non-members of this non-profit organization. And why there is no opt-out? Committee says small content creators cannot enforce opt-outs effectively. Okay, a uniform rule creates clarity and it will avoid the litigations. However, NASCOM has dissented it, saying that mandatory royalty is equal to tax on innovation. And it also argued that creators should be allowed to block this AI if they want. Now, why this matters? Because major Indian news publishers are already suing AI firms for copyright violation. India is trying to balance now this both innovation as well as the creators' rights. The next article is Supreme Court asks Center to give nationwide data on missing children. This came during a hearing on a PIL highlighting that many missing children across states are still not traced. Okay. All states and UTs have appointed nodal officers to track missing children and upload information on the Mission Vatsalya portal. Okay, but the Union Home Ministry itself had not appointed a nodal officer, even though it is supposed to coordinate efforts nationally. Now, what is this Mission Vatsalya? It is an initiative under Ministry of Women and Child Development to strengthen the child protection systems, supporting children in difficult situations like abuse, neglect, exploitation, and promoting non-institutional care, family or community based, as a priority over institutionalization. The next is the rise in global use of Aadhaar like ID systems dangerous. Okay. There is a global spread of Aadhaar like digital ID systems, and countries like Morocco, Philippines, Sri Lanka, Ethiopia, and Uganda are adopting modular open source identity platform which is supported by India. Okay, and the key concerns that were raised by these civil society groups and 200 individuals are the risk of surveillance and privacy violations, because centralized biometric IDs can allow governments to track citizens, creating a surveillance state. Okay, especially in countries with weak data protection laws. Second, exclusion of the vulnerable groups. Errors in biometric authentication can deny basic services, disproportionately hurting the poor and the marginalized. Number 3, no strong legal safeguards. Many countries adopting these systems do not have robust privacy laws or independent regulators, which increases the risk of misuse. Number 4. Exporting an untested model. See, India is promoting Aadhaar like systems abroad through platforms such as MOSIP. Even though Aadhaar itself has faced debates on data security, exclusion, and rights. Okay. Number 5. Digital identity is not equal to digital empowerment. The signatories argue that building ID systems without strengthening welfare systems, grievance redress, and digital literacy can actually worsen inequality. The next article is most retail investor money went to fund promoters in 2025. Okay, one data point that you can take from this article is demat accounts has grown cut. Demat accounts has grown nearly 5 times over the last 5 years. And this is linked to the pandemic boom because during the pandemic times there were rise in these IPOs, and that shows that demat accounts are also rising. That is the takeaway from this article. The next article is cyclone impact. We are going to look into this IMF agreement. The point that we are going to see is extended fund facility program of the IMF. Okay, what is this extended fund facility program? It is a financial assistance program from the IMF for member countries with serious medium term balance of payments problems. It provides loans for an extended period, typically 3 to 4 years, to help countries implement structural reforms to correct their economic weaknesses, reduce poverty, and promote growth. The repayment period is longer than the standard IMF loans, typically over 4.5 to 10 years. As a condition for the loan, the borrowing country must agree to and implement specific economic policies and structural reforms. Yesterday, we have seen about Cambodia and Thailand in places in news, so I'm skipping that. And regarding this peace plan, it is yet to confirm, so we will wait for that. Now, the places in news that we are going to see is the Kazakhstan. So, the countries bordering Kazakhstan are Russia, China, Kyrgyzstan, Uzbekistan, Turkmenistan, and it also borders with Caspian Sea. That's all for today. Thank you all for joining.